Good evening. My name is Aaron White. I'm the Executive Director of Downtown Eau Claire, Inc. and the Economic Development Manager for the City of Eau Claire. And I'd like to welcome everybody. Thank you for joining us to our first Idea Lounge in about 3 years, I believe. So thank you for joining us this evening. The Idea Lounge is a format that DECI has utilized to bring ideas and issues to the community and to the businesses in the downtown area to look for ideas or talk about, as I said, issues. Recently, due to events that have been occurring and the reopening of kind of the community, the businesses approached us and asked if there was a way to start the conversation related to our unhoused population in the community. It touches a lot of different areas and a lot of different folks. So we invited and brought in business folks from the community as well as social services and resources who work with the unhoused population regularly to just talk about what's going on and what we can do to start moving this conversation forward again. Just a quick overview on the format. I will be introducing TJ Atkins. She will be our moderator for this evening. And what we will start with is introductions to the panelists and a brief overview of their organization and what they do. We will then move into a section where the surveys that the businesses filled out prior to this event, we aggregated a lot of the common platform comments, and TJ will be going through those comments with the panelists and having them kind of answer the things that are brought up by the businesses. The last section of the time this evening, about the last 30 minutes or so, we will open it up for a general Q&A from the audience to talk about what's been already discussed, bring up any other issues or things like that. So that's going to be our general format for this evening. Any questions or thoughts before we kick this off? Oh, absolutely. Housekeeping. Pablo has asked that for if you need to use the restroom, just head back down the way cave, and they're using the restrooms past the main office or the box office. So that'd be the route for the restrooms. So at this point in time, I'd like to introduce TJ Atkins, the Executive Director of the Community Table, who will be your moderator for this evening. TJ.
Thanks, Aaron. Good evening, everyone, and welcome to the Idea Lounge. As Aaron explained, we're going to just kind of go through the grouped questions that we had and do introductions of the group here soon. But just to kind of give you an overview of the sections of the questions that we have are areas of resources, data, policing and response. And then the last area is collaborative efforts and then future discussions. I'll go ahead and start on my left and go that way for introductions.
Hello, my name is Jim Southworth. I'm with the Eau Claire Police Department. I'm in charge of the North District. I'm a lieutenant for the department. So the North District encompasses everything from Sojourner House up north to the airport and following downtown all the way to the east. So that's what I'm in charge of.
And I'm Lita Prorok. I am the new co-response coordinator with the Eau Claire Police Department. This is my third week in the job, so I am still kind of trekking the way and working with the police department to figure out where we're going to start and where we're going to head with this project.
Hi everyone, I am Dr. Janice Briggs and I'm the new Equity, Diversity and Inclusion Coordinator for both the city and the county. I've been in Eau Claire for 2 months, and so I have been in and out of the community meeting folks, businesses, individuals, organizations to gather some initial data for this role, as I see it as a co-creation of our community creating this role together, as well as internally as my fellow coworkers, as we look at where are we now, where do we want to go, and how will we get there together.
Hi everyone, my name is Libby Richter. I am the social worker at the public library here in Eau Claire. I average around 1,000 contacts a year with our community members, connecting individuals to resources and helping kind of have that warm handoff for individuals to connect people and get people to where they want to be faster. So I help bridge those gaps in the community, and I'm looking forward to hearing from all of you and how we can work together for our downtown community.
Good evening. I don't think this is.
It's on. You got to move it closer.
Good evening.
Hello, hello. I got it. Calm down.
There it goes. Check. There we go.
There you go.
Good evening. I'm Kevin Birch with Catholic Charities. I'm the Director of Housing Services. I oversee our housing counseling our shelters, which include the Sojourner House here in Eau Claire, and then the warming centers in Wausau and in La Crosse. And then I also oversee our Beyond Shelter program and our representative payee.
Hi everyone, my name is Katie Petska and I work at Lutheran Social Services. I'm a manager and one of the programs I manage is Gaining Grounds, which is a daytime resource center that serves people who are not necessarily in an actual crisis, but we want to prevent people from getting into that crisis. So we provide outreach services. It's mostly for people who are experiencing barriers to their health and well-being.
Hi, I'm Kim Carey. I'm the Associate and Fiscal Director for Bolton Refuge House. And for anyone who's not aware of it, we are a domestic violence and sexual assault program here in Eau Claire. We provided services to a little over 3,400 people in 2020.
Hello, my name is Jeannie Sem, and I work for Western Dairyland. At the agency, I am the Housing Services Program Manager. We run programs. I oversee programs for homeless prevention, rapid rehousing, homeless shelter for families, permanent supportive housing, and I'm sure I'm forgetting something, and prevention, or no, and coordinated entry.
Whoops, excuse me. Hi, I'm Amy Gianni, and I'm the Executive Director at Family Promise of the Chippewa Valley, also known as the Beacon House, and we are a family shelter. We can house up to 6 families at a time. With COVID, we reduced that capacity to just a tiny bit, but we are bumping that back up, and we also have rapid housing, work with the coordinated entry programs and things, and a little bit of outreach as well with our program. Thank you.
Thank you. And we're going to go ahead and kick off then with our first group of questions regarding the area of resources. Address that there are several other resources in the community that aren't on this panel, but there is a resource guide that has a majority of them listed. Touch on partnerships between all, and if people have specific questions on those organizations and who serve, that those can be covered at the end, and we'll have Libby go ahead and discuss that.
Yeah, so I brought for you all a resource guide that's over on the main table over here that covers a good chunk of Eau Claire's resources regarding social services. This is a really great tool to utilize, but you have to kind of better understand it. So it's hard to have this and just hand it to someone without explaining what it is that they need to connect with. So my hope is for you guys to learn a little bit more about the resources that are in our community so that you know who to connect people to. And if you don't know who to connect people to, a lot of these people at the table here, including myself, are great people to call up and say, I know someone who is needing help with X, Y, or Z. Where should they go? So that just is one step that you can take to better understand our community, better understand the resources that are here. We also have a little pocket no wrong door card. So this is really geared specifically towards individuals experiencing homelessness. It has a list of individuals who can get people on the coordinated entry list. So as Jeannie mentioned, coordinated entry is one of the systems we have in Eau Claire, and that's a program that we have for getting people into housing services. So that is just one important tool to hand off to people, and I hope that you feel empowered to utilize that resource to give to people. If you have questions about the resources in the resource guide, please feel free to ask afterwards or throughout this program, but I want you to know that it touches on everything from healthcare to how to access food to financial resources to jobs, everything. So I updated it briefly with some of our changes, like for example, Women's Way is no longer a program, but we have, and Positive Avenues has shifted, so I've updated that information in there, and you'll see that reflected from these recent changes over the last year or so.
Okay, thank you. What programs are in place to assist in reliable, provided housing and progression into self-sustaining housing? And Jeannie, we have you up for that, but perhaps you want to explain a little bit more about coordinated entry for people.
Sure, I can speak to that a little bit. For those of you who do have businesses downtown or come into any contact with homeless individuals, we have a system. It's set up statewide. It's called coordinated entry. It is where we do assessments with individuals. to find out their vulnerability, to find out how long they've been homeless, and find out what kinds of service needs they have. And then they're placed on a coordinated entry prioritization list, which then determines they would be next in line for housing, or they're placed on this list that actually prioritizes them based on their vulnerability for housing, for some of our housing programs.
The next question is, are there any programs for reentry into the workforce and housing for unhoused individuals in Eau Claire? Did anyone want to lob that one?
I can speak a little bit to that. I don't know if there's an actual program, but we do a lot of work out of Sojourner, and every Wednesday we do have representative from Workforce Development come down to the shelter. He's there every Wednesday, and I do have a flyer I can give out to everyone, and he will help anybody who is interested in gaining meaningful employment to do the necessary steps that would take to get them employed. He's willing to be on call too. Like, this is where he'll be at a certain time, but if we call him and we say there's a person interested in getting a job, he'll come down if he's available.
Okay. Anybody else want to field that? All right. Where can unhoused go during the day?
That's a really good question.
The community table for a meal.
Right.
That's one location, but that's only for mealtime. Right now, what do we have in place?
We do have a program in Sojo, and Sojourner House, people might not know the Sojo language, so the Gaining Ground does provide services out of the Sojourner location. We also provide services out of another LSS building, and we're willing to do outreach too. So if a person doesn't feel comfortable coming somewhere, we'll meet them at a park. For them to be, in the facility at this time, they need to be working towards a goal of theirs, whether it be grocery shopping, looking for housing, looking for work. And all this information is on the flyer, what we can work with individuals towards. We do encourage people to make appointments, but they can also walk into our services, and if there's a staff available, they will meet with them immediately. So that's one place some people can go during the day.
That's one place, and then they come to community table for lunch on 3 or 4 days a week. The other location I know is the library. Libby, you want to probably talk about what they do there?
Yeah, at the library, individuals, just like every community member, is welcome to utilize our resources there. And we are happy to work with individuals one-on-one if they would like. And it's also just a peaceful place to be. It is a low barrier place, but it is just one of many places where people can go.
I could also speak a little bit to that. On Mondays and Wednesdays at the Sojourner House from 8 until noon. We are doing outreach to the homeless and to the unsheltered, offering up laundry and showers. So that's on Mondays and Wednesdays.
Okay. Nope. Okay. Any other comments? Okay. What is protocol for someone like Marlene, who has been restricted from all the resources? Marilyn, I'm sorry.
So we had some discussion about this, and I think this is reflective of, if you've seen the Volume 1 article about Marilyn Rober. So I believe that what I would like to say is that Marilyn, from my understanding and from everything I've heard, is she was likely not restricted from resources necessarily. She had some very difficult internal barriers that impacted her ability to access resources effectively. And there is a large portion of our community that is struggling with things like that. And that is a different question. That's a mental health question. And mental health is something hard to overcome. Mental health is something hard to work through, and it takes a community-based effort to lift people up and work together. And still, even then, individuals have self-determination that impacts their ability to access resources. So I appreciate, someone who, submitted this question, but I want individuals to know too that this is a very, very complex question that is not easily answered, and we all have to work together to try to help make sure that individuals like Marilyn maybe don't end up passing away on a park bench and maybe end up being able to die with some kind of dignity instead.
I would second that. I just want to point out that some of these people are offered multiple different services, and if they turn them down, we cannot force them to accept the different services. So I agree with Libby. When there are mental health issues involved, it makes it very difficult for them to make decisions for themselves on their behalf, and that was just a really, unfortunate, very unfortunate situation. But yeah, I don't.
I agree with both the ladies. In the business that we're handling with people, we're seeing mental health issues rating as high as 51% of the people we work with. There's times when we're offering services, but some people's mental health status is so severe that it becomes a liability for some agencies to have them when they can potentially pose a danger to the other people that you have within a shelter. It makes it really difficult to house them. And that becomes something that hurts us all when we have to make those decisions that we're not capable of working with them and try to find other services. Many times these people will turn. The police end up getting called on, police respond, they take them to the hospital looks them over. If they're not deemed a liability to themselves or someone else, the hospital turns around and releases them. It becomes a vicious cycle and circle throughout all of our agencies.
Yeah, and I could probably speak for most of the providers up here, is that if they're restricted, it's probably a day, just because of a behavior, but they're never banned for life, I think is the correct word that I want to use. That never happens. We try to coordinate amongst ourselves and with that individual to make sure that they're getting their needs met. But if there's a particular day that they might not be as stable as they should be, and there's a behavior, we do ask them to leave on that particular day, but they can come back the next day and be perfectly fine. So, and we've had that happen at community table often. So,
I think too, I'd just like to speak to during severe weather situations, extreme cold. At the Sojourner House, we may have bans that are out there, but during those types of situations, when we're in the overflow, we lift those bans to keep people safe. It's more of an emergency management situation and keeping people alive than it is, a ban or something like that. So those bans are lifted in shelter when those situations arise.
and they're very rare. I mean, in the year and a half I think I've been with community table, and we've never had one. And there hasn't been any since prior to my being there as well, too. Okay, any other comments?
Could we touch a little bit more on housing? I think we skimmed over that a little bit. I think something that's important for individuals to know here too is that there are a lot of housing programs in our community. TJ and I were, this was a few months ago, we're looking through, piling through and being like, okay, there's this program and this program, and this there are so many programs, and I want you to know that there are a ton of options, and that's why it's really critical that you guys use that knowledge to point people in the direction of a social service, because then they can have someone to help them navigate that program. Because when you are stressed and you don't know where your next meal is coming from, or where your head's going to hit a pillow that night, or everything like that, trying to navigate these housing systems is not an easy endeavor at all. So there's city housing, county housing, there's different types of subsidized programs, and there's so many different layers and options for individuals, and it is not an easy thing to navigate at all. So there's individuals who will help a lot of people at this table, and there's many barriers that people face even after that. So say they get to meet with one of us, they have to be able to get contacted to say, hey, it's your turn, you get housing. But their phone was stolen, or maybe something else happened and they're not able to get contacted at that time. So a lot of individuals get dropped and then they end up back in this cycle over and over and over again. So I just wanted to make sure that that was very clear, that there's more than just the coordinated entry program. There's a lot of housing assistance programs that we do have in the area that do help support people. But they're also not enough. We don't have enough vouchers to give to every single individual that is experiencing homelessness in our community right now. It would be wonderful if we did. And then even if we did have all of those vouchers, we don't have enough landlords that are willing to work with individuals who might have a past that might be deemed colored or not as preferable for individuals. So making sure that talking to people. And if you are a landlord or if you know landlords, there's some really great programs that exist to try to help alleviate that barrier. So I don't know if we're planning on talking about it later. Okay, perfect. But we'll talk about that later.
Can I just speak
Yes.
about that as well? I was going to say that's one of the beauties of coordinated entry is the ability to get hooked up with all these different programs. So you don't have to, your homeless person doesn't have to navigate through this themselves. Coordinated entry is a wonderful process that helps us place individuals in the different housing programs that they should be in depending upon their vulnerability. And the nice thing about that is too, our staff do the city and county housing applications with them and all of that good stuff. So it's a good thing to have them involved in that.
Thank you. Any other comments? Okay. Next section we have is on data. What is the demographic makeup of our unhoused population in Eau Claire? And Jeannie, I'm going to pitch this to you because you probably know a sliver of that population.
So last night, I don't know if you guys know what this is, but we were participating in the Point in Time Street Count. It's a twice annual event where we go out, hit the streets, recruit volunteers, and try to find the unsheltered homeless people in the area. Although our surveys aren't all turned in yet, just from last night, we were between the 30 and 40 mark. And that's obviously low, but it is one of the highest numbers we've ever had. And I'm very shocked about it because it was terrible weather. I thought, this is the night we're not going to find anybody. And we did. I mean, they're out there. Yeah. So I can't tell you, I can't give you an exact number, but that's where we were at last night.
Yeah, and that's a higher number that we've seen in previous years, especially when we do it twice a year. We usually expect the January number to be low, which it wasn't though because of the combined Sojourner and Gaining Grounds this past January, and then now we have this summer. So yeah, those are some data that I don't know if a lot of you are aware of. There's our Dairyland Housing Coalition that includes 5 counties of Eau Claire, and Jeannie, correct me, Trempealeau,
Trempealeau, Jackson, Buffalo, and Eau Claire.
Okay. I never remember the other 3.
It's okay.
But they meet on a monthly basis and look at those numbers to see what kind of services we need to have in place, what's happening with those, looking at funding for those individual programs. Anyone it's open to the public, it's open to the community, anyone can join. Right now, I think we have a strong 30 people that serve on it between those 5 counties. So it's a lot of providers, but it's also a lot of government and community members that serve on that too. So I invite you to come to that meeting. It is a lot of information, I will warn you now.
Something that we get the question on, a lot of the things that the businesses brought up was the breakout of how many of these are local folks who are experiencing unhoused or homelessness here versus folks who are out of the region or out of state. That's a common question we get. And we want to make sure there's no misperceptions about where these folks are originally from. Do they have ties to the community or not? So maybe the panel could address the question from that standpoint.
Well, I guess I can start. I know, our numbers are a little bit different. We've started in the last probably 3 or 4 years collecting data when we have contact with people for some reason. The numbers that we're showing are anywhere between 30 to 40% of the people are not from Eau Claire, are coming from outside the area. But once again, once they've been here for a year, they've been in the system here, then they consider Eau Claire homes, and that's what ends up happening, is that they end up staying here once they get here. But we have about 30 to 40% of the people we're running into from initial contacts are not from the area.
And then Kevin, if you want to report what shelter's seeing.
Yeah, so from the Sojourner House, the guests that are staying there is a little bit, the nation average is right around 80% of homeless people are local to the area or have ties to the areas that they're in. From shelter standpoint, our numbers are a little bit higher than the national average. We're right around 87% over the last 2 years of people who are either local or have ties to the locality or are close by. So we're a little bit higher than that national average. One thing I always like to say is, if all of us sitting in this room chose to be homeless, I don't think we would choose Eau Claire. We would choose a warmer climate to be homeless in and not have to deal with the winters and things like that. And I mean, really, the cold weather is extreme, and the people that are here, and sometimes it is a tie to the penal system. We're on the belt from Chicago to the cities to the Dakotas. And, if they're arrested here and they have charges here, they're here. And they're our neighbors. And we need to be able to support them in their barriers and struggles they're having.
Anybody else want to give some?
The one part of the question here is asking, what are the demographics? That's really anything. The homeless population spans pretty much every demographic there is, from old to young, ethnic groups. It's everybody. You look around, and it's everybody in this room. So that's almost an impossible question to answer.
And I would like to combat that perception that, this is other people's problem that is coming here or something like that, because these are our community members, these are our neighbors. And if you're if you're in a community that is constantly treating people who are experiencing homelessness as something not good, as something like that, if you're putting that energy towards someone, yeah, of course they're going to move on, and they're going to try to find somewhere else that might be a little friendlier. So there's a reason why people travel when they're experiencing homelessness, because they're looking for some place that's going to make them feel safe. So yeah, there is a percentage of people who do move around.
I would just reiterate what Kim said about there not being really a norm for homelessness. I think that, the stigma has always been it's the alcoholic 50-year-old who can't keep a job and lazy and, that sort of thing. And although you will, obviously you'll see some of those folks, we deal with families who may be down on their luck because of COVID, they lost their job, or because they overextended themselves and one of the parents lost their job. It really varies between, we're seeing just so many different populations, and yeah, I just don't want you to think that, just the male with the with the drunk, yeah, exactly. That's not the norm.
Well, and I think, too, an alarming thing for all of us sitting here and those of you in the community, and we're seeing this across the other cities we serve in and probably across the nation, but the population is actually getting younger. It used to be in that, 40s to 50s, 60s range. And, we're seeing children that are aging out of the foster care system that have no place to go. So seeing that population become younger is a scary thing for all of us up here.
And to add on to that, we know within the school district that there's upward 200 plus families that are homeless, that are considered couch surfing. So you may encounter them and never know. That doesn't even go into the number that we calculate when we're doing numbers and looking at funding for the area. So it's a much bigger challenge and topic that is just now visible because of the scenario of the pandemic, because of changing models for businesses, changing locations of where people are at. So it becomes more kind of in your face. So I just want to kind of announce that and let that be known that I think one of the comments we had was it wasn't like this 10 years ago. Well, it probably was, you just didn't see it because people were in different areas that weren't visible to you. Next question we have under data is approximately how many unhoused individuals reside in Eau Claire? I don't think we have a way to calculate that.
No.
Yeah.
They don't always want to be found. That's
Right.
the thing. And they don't want services, so they don't, we do have a new street outreach program that goes out into the community on a regular basis who offer supports and things like just, clothing, shoes, water, food, can openers, just, things like that. Yeah. And yeah.
And that number you talked about too, TJ, the couch surfing, that's a number we don't capture.
Sure, yeah.
So it's a very difficult.
Yeah, the school district captures it because we have a liaison that works with those families. But if we did not have that role, I don't know if we would ever calculate that number. Go ahead, Kim.
And TJ, part of what Kevin's referring to also when he's talking about the population getting younger and younger, and something we haven't touched on, is unfortunately within the LGBTQ community, as children start to come out, especially in their teenage years, oftentimes their families abandon them, and it's like out the door. And so now we've got this whole other population of young people that are many of the couch surfers and many of the people who don't have the ability to do something at that moment with their life because they still need some support from people around them, which they all of a sudden now don't have.
Very good comment. Do most consider the Chippewa Valley home and also grow up here? I think we already asked that. Sorry. Policing and response. What are the current community procedures to report concerns with unhoused or homeless individuals? How resource providers work together to connect them with the correct resource partner in our community gap in central assessing individuals to refer them. I know I could talk from how we do it at the community table. So we have an outreach coordinator. If you haven't met him, he's Mike. He's wonderful. He sits outside during meal service to connect with individuals. And if they have questions, if they have concerns, he meets with them. He's helped an individual get their Social Security set up here. He's helped, we have different things that we have in terms of hygiene items. We've connected them with Sojourner. We've connected them with Gaining Grounds in terms of that crisis resource. So that's how we triage it. I know at our location, if anybody else want to kind of share how they handle those at their location. And then we get Jim and them. How do you guys respond to it?
Well, I mean, from what we saw in the response back from the business owners is that, it seems like the number one response from people is we call the non-emergency line and have police respond. That's not ideal. And the reason I say that is, I'm going to skip ahead a question here, but, what do police do about criminalization of homelessness? We don't. The last thing in the world we want to do is criminalize somebody's behaviors for different things. I mean, the type of calls we get involving the unhoused population is, somebody's sitting on a bench outside my business and it's driving away customers. We can't do anything about that. That's a public bench. They have the right to be on that bench. And so we're not going to force somebody away from that bench. if somebody's just laying in Phoenix Park, they're enjoying the sun just like anybody else, we're not going to go in and get involved in that. So the things we get involved in would be criminal behavior. If somebody's stealing things, if somebody's creating a disturbance, that type of stuff, that's when we want to get involved in the situation. On a daily basis, there's probably 10 to 15 calls involving, unhoused individuals doing something in the community that doesn't look normal or doesn't look right to people, so they call the not-emergency line, which is fine. But a lot of times I can tell you who the person is during the dispatch because we've already contacted the person 3 other times that day. And so if we have public space cameras in the area, I'll just put the public space cameras on the individual, see if there's anything criminal be happening, and then we won't even respond. Because that's the same behavior, and it's nothing that's reaching mental health issues that are a complete danger to themselves or others. They're not committing any crime, therefore the police will not respond to that type of case. Kind of going off on a rant here, I'm sorry, but I just want to make sure it's very clear. So, when we end up with other situations where if somebody, a business owner or whoever comes up and there's somebody loitering on their property, now that's your property, yes, but you have the right to ask that person to move along as well. And if they refuse to leave, then you can call us and we'll assist in removal of that person for you. But we want the community to ask these people to move along first if they're in your business area. If they're outside your business on the sidewalk, that they have every right to be there. So that's kind of our response on that.
DJ, can I kind of add, can you hear me?
Yep.
So we've all talked on this panel about when that happens, that there is a huge gap between what a person who's not in a crisis where they're not going to hurt themselves or others, where the police really shouldn't and can't intervene. So that's when we switched our business model to help fill that gap. So those are the people that Gaining Ground want to help support. So they're not at the point of being at the hospital, but maybe nobody exactly knows how to help them. So I'm going to give out our flyer and our number to everyone who's here. If that is an issue, please feel free to call us, and we're willing to meet with the person. If the person is willing to meet with us, we will meet with them. If they want us to come to your place of business or wherever, we will meet them there. And we can try to help support them so they don't get to that crisis state. We want to prevent people from going to the hospital, going to the ER, and even having to get into that crisis state. So that is a real huge part of the service that we're trying to provide and that we want to provide.
Any other comments? Otherwise, I'm going to skip ahead. Jim answered a couple of these already.
Sorry about that.
No, you're fine. Advice on measures to mitigate trespassing on property or disturbing business. Can you be a little bit more elaborate on that?
Yeah. So there are certain situations where things come up. Like last summer, for example, the public restrooms in Phoenix Park became a congregation spot where people, couldn't even get in the doors of the restroom, that type of stuff. And so we did add some, no loitering signs outside the restroom. And we also have worked with the city parks to, at certain times, shut down power outlets to avoid congregation around certain areas. So we've seen a couple of different businesses in downtown that have called and requested assistance from us. And, we're not going to, we can offer advice on environmental design type of things, where you can put up some fencing or some gates in certain areas where it's like an alleyway where it might be a congregation point where you don't want people hanging out. If you have outlets on the outside of your building and you don't want people charging their phones on it, then you need to shut down the power to that outlet at certain times when you don't need it. So there's a lot of different things environmentally you can do to kind of reduce some of that loitering type of behavior if you don't want that to take place on your property.
Okay, we discussed what are some non-police options for unhoused. I know Katie mentioned some. Is there any other ones that you guys could think of?
Refer them to resources.
Yes.
Yeah. That's the best way that you can help people, because by criminalizing calling police, you're creating another barrier for them getting housing. So you're preventing individuals from getting off the streets every time that you call the police unnecessarily. It's gonna hurt them more. So connect people to resources to help get them support that they need is my hope for all you.
All right, last category, collaborative efforts and future. Under collaborative efforts, is there a coordinated effort to do street outreach? And I think Jeannie's talked on some of these. I know Katie has some as well at their location. I know Kevin has some as well at his location. We have our outreach coordinator as well at our location. Amy, do you guys have someone during the day? I think you do.
Yes, we do.
Yes. So all those resources, you can call any of us and we'll have an individual to assist them if, over the phone, or if we need to be, for some of them at that location, they'll go. Street Ministries, I'm not sure why they're not here. Is anybody in the audience? Yeah. So the Street Ministries, if you're on Facebook, I think Julian mentioned them in his article for Volume 1. They are an organization that usually comes at night. They're kind of that gap between us and when Sojourners opens. They usually provide a meal. They give out lots of like hygiene type things, but then they also go to people that they've been in contact with throughout the community. So they'll go directly to individuals where they know that they're at to just kind of check up on people. And it's people that this panel may not know. It's people that I may not know. It's just individuals that prefer that isolation than to being in or utilizing any of the services. So Street Outreach is one of the organizations that has done that for the number of years. And so their connection is a little bit different than any of ours. Okay. Oh. Where can they get medical attention if needed? And I think it's Ken here. Yeah. So Ken Adler, there's the Chippewa Valley Free Clinic that has hours there over by HSHS. And we can get that I think they're actually on the pamphlet in terms of medical, where you can get services. And it's a free clinic that they can go and get care for, and they do dental services as well as some mental health. They have a psychiatrist, they have eye doctors, and then they do medical as well. They also, at one point, I don't know if that's still true or not, Ken, correct me, they have individuals there that help connect people to get onto Badger Care and insurance as well. So they have those benefits available to them if they need to go to the emergency room or if they need to use urgent care. They would have that medical card available then to them.
Yep. To clarify too, the free clinic serves individuals who do not have insurance.
Correct.
That's their primary focus, is to meet people's needs who do not have insurance. They get people signed up so they can use the major health systems, because we are blessed with many in this community. So so that's really their primary focus. And there are tons of hospitals in the area. Individuals are welcome to access. A lot of the hospitals do have benefit navigators as well to get people signed up.
Yeah, I know the Aging and Disability Resource Center works with some of the individuals as well. Those are the ones off the top of my head.
Sorry, one more thing. Vivant Health is another wonderful resource as well for individuals who are wanting to maybe work on recovery or to be able to have lower risk drug use, so that we aren't seeing as many individuals overdosing in our community. They give out free kits for individuals to use to test their drugs before use. So they are an excellent, amazing resource, and give people clean needles so that they're reducing that barrier, so that we aren't having individuals hopefully overdosing on our streets and keeping people alive. So,
and they have a housing specialist as well.
Yeah.
Are there any checks for people who are in a consistent spot? Yes, that would be the Chippewa Valley Street Ministries. Future, what is the community doing to investigate other options that what we are doing now? I think I know we talk about it a lot at the Dairyland Housing Coalition. I know Jonah talks about it quite a bit when we're looking at affordable housing. Those are the two main avenues that we've been utilizing right now. We have some of the kind of ripple effects from the sprint that happened a couple years ago, where we set up a landlord support program that includes a ready-to-rent class for these individuals that have high barriers, to kind of help boost their application in the pile, so to speak, and teaches them a variety of different things in terms of how to be a good tenant, financial credits, housing ordinances, lights, and things of that nature. And then to couple that class, there is a risk mitigation fund for landlords to access that helps if there's an issue with that tenant that's come through that program. So that's one of the ripple effects of that. I know there was some process things that we kind of cleaned up and tightened up when we were looking at housing and reentry in terms of that coordinated entry list. We actually added, I think Catholic Charities added that time that they were then added to the court to enter coordinated entry off of that sprint, was adding additional users for that. So those are some of the things that we're coordinating right now. What is the city doing to figure out permanent housing options for those living outside? Go ahead, Kim.
I want to talk about something that we've only lightly touched on. And I'm going to give you two different scenarios of people. We've already heard that our homeless population has some real barriers to even trying to attain housing. Well, I'll tell you, this spring I went around town with my niece, who's a university student, has a very solid person that would back and co-sign for her. We started looking for housing here in Eau Claire. We'd arrive at an apartment, 15 people, and the landlord cut it off at 15 people. We're there to look at that one apartment. I can't tell you how many apartments I went because my sister wasn't available to be here to do it with her daughter, looking for a university student to find housing. So how do you now, what do you do with people who have barriers, who don't have the ability and the resources that a university student does, and we're supposed to put them all in housing? We need more housing. There's just simply not enough housing in this community. We're at a negative housing resource here in the community.
And note, affordable housing. We have housing. We have tons of housing. But affordable for this demographic is almost none. And no sooner do they get housed than, I mean, you just, the list keeps going. So that, yeah, correct, Kim. There is that gap that we have in terms of affordable housing here in Eau Claire. And I know the Jonah Affordable Task Force is working on that. Planning Commission looks at some of those things as well. What jobs are we as a downtown community committed to creating so housing displaced individuals can find jobs that will afford them a livable lifestyle? I don't think we would know that. Aaron? Aaron says he's got it.
So I'll take a crack at this one, at least part of the answer. Working with a number of businesses in the community as the economic development manager, there are a ton of positions open. Industries across the community are open and looking to hire folks that even have no skill set. You know, they're willing to train them on the job, get them going. But the biggest challenge is for a lot of these folks is just being in a position where they can take advantage of these open positions, having a place where they can take a shower before they go to work, or take a shower when they get home, or have a good place to sleep. It has to start at a more basic needs level before they can go and be able to hold down a job. One of our local manufacturers hired, I'm trying to remember, they hired almost half a dozen or so workers straight out of Sojourner House. Put them to work, and a couple of them were able to maintain the job. They became great employees. They got them into a car, they got them into an apartment, and worked really well. But unfortunately, the barriers that the folks are talking about made the others not viable to maintain that employment. Not being able to, whether it's not being able to get up because they don't have power to run an alarm clock to tell them it's time to go to work. There's basic needs that have to be met, and you'll see that trend when they talk about workforce, and then they talk about putting the folks who are unhoused to work. You'll see a lot of the trend. You'll hear it nationally. They talk about housing first to address that basic need, and then the resources that are also here in terms of job training through CVTC or the other partners can come into play. But they have to have at least a semi-stable environment to start with before they're really going to be able to take advantage of the training and be able to step into positions that are available. It's not a perfect answer, but hopefully that helps a little bit.
Okay, we're going to switch a little bit gears. We've been talking about a lot of what's not working. So let's talk about what is working. If you guys want to just talk about some of your programs, housing first. I know Aaron already mentioned that, so Jeannie, if you want to start on that one.
I love to talk about that one. So Housing First is a model, but we run permanent supportive housing under the Housing First model. Basically, what we do is we take those people that are the highest barriered, so those people off of the top of the coordinated entry list we talked about earlier, and we put them into housing. And it's, right now we have 25 units so we're housing 25 of the most chronically homeless people in the community. It's a challenge. Some of these folks, they all have disabilities. They've been homeless for a very long time. And they don't always know how to take care of themselves or their unit. So we spend a lot of time doing life skills and things like that. But once they do have housing, they're able to attend to their other needs. When you have, you have homeless people on the streets that have medical issues, whether they be mental health or physical health, they aren't able to address those issues when they are on the streets. Like, they're not taking their meds. They're not, or they maybe haven't even been to a doctor. And so that's the beauty of this program is we, once we get them housed, we take care of their other needs. So they're, can we get them in to see a doctor? Can we get them on meds? Can we, we can't force them to. Everything is client-centered, but it's a great program. We have a lot of successes, and a lot of people don't hear the successes. Some of the people, it's really been so wonderful seeing some of the people get jobs, get the mental health care that they need, take care of themselves. Just the little things that you guys don't, maybe think are big deals are really big deals with these people. And so, yeah, that's our permanent housing program. It's not time limited. They can be in housing for years. And we have, really in-depth case management that goes along with that. So people that are going in to their units every week to do home visits and making sure they're keeping their apartments clean or taking their garbage out or, taking their meds or, things like that. We also have rapid rehousing. That's a program for homeless families and individuals who are next prioritized on the coordinated entry list. That program assists individuals with finding housing, and we are able to pay short-term, and long-term, because LSS also offers it, and so does. And so, yeah, rapid rehousing is another program where we can pay some rent subsidies and help people stay in housing. We're just going to be running a prevention program starting up soon. That's to try and prevent people from becoming homeless so they're not out on the streets. So this is going to be new to Western Dairyland. I don't know, or going to give it a whirl. And I think, what other programs do you guys have?
Yeah, Beacon House.
No?
So we've had a few really good successes. The one really good thing about our program is we are doing intense case management. I think a lot of people on the stage are, but we are dedicating one-on-one time with the individual to staff. I mean, it could be 2 hours a day, it could be 5 hours a day. It really is what that individual needs to succeed. So we've helped people get housing vouchers. We've helped people tour apartments. We've met them at apartment buildings and met them before they were going to go talk to the landlord and kind of coach them and help them so they are, I don't want to say act appropriate, but the landlord is willing to rent to them. We've helped people sign up for Badger Care and get health insurance so then they can go to the doctor. We worked with, I believe it was Vivant Health, to get people med boxes so a lot of people that are in this community, their medications get stolen. So we've worked with people to get those medication boxes so their medications are safe and secure and they can take their medications every day. We have helped a ton of people connect with the Jobs Resource Center and lots of employment. I think some of what he was, I'm sorry, I don't know your name, but there was a ton of successes where people were, People Ready was contacting us and Sojourner, and they were coming, and it was supposed to be a temporary job, but some of them did so well that they were signed on long-term. So we have had a lot of really good successes, and we are hoping for a lot more.
I'd like to speak a little bit about our St. Lawrence Community Services program that has been in Eau Claire for a long time. We also focus a lot on housing counseling and center around prevention. But we do everything from right now street outreach to the homeless and unsheltered, all the way to home buyer education and pretty much everything in between. Foreclosure counseling, and we offer rental assistance, also connecting people who are in shelter with the resources that they need. Simple things that you and I would take for granted, having a phone, having an ID, just those simple things that are barriers from obtaining employment, and then working with the shelter staff to continue once they are employed and in shelter, what's the plan, meeting with them and goal planning and coming up with an action plan that fits the individual. They have been huge successes, and we have placed a lot of people into housing that come from shelter. I will personally say one of my favorite things to see, and they're heroes to me, someone who is homeless in shelter, which I feel is one of the worst housing situations you could possibly have, other than being unsheltered on the streets. But to see them maintain a job, maintain sobriety, while in shelter and facing all of the barriers that are in front of them, and then leave shelter to their own housing, there's nothing more amazing. And to me, they are the true heroes of our community to be able to we always say, pull themselves up by the bootstraps. It takes a community to help facilitate that, but to see people who have had that help and succeed, there's nothing more amazing. So, thanks.
And I just wanted to share just some things that we've seen. I know in my office, I walk out to the dining area, and that's where families live. That's their living quarters, and then they have rooms that they go to. But what was humbling to me, especially during the pandemic, is we had Wi-Fi, and you walk out and you see the kids on Zoom, their Zoom class, and mom or dad is over there filling out their job application or their housing application. So they're both doing their homework, and just having the parents come to us later and say, we wouldn't have been able to do this. We would have been in the car trying to find Wi-Fi somewhere or whatever we could do, and we help provide that structure. So it's those kind of things that, that you have to take with you every day to go, okay, this is why we do what we do, and it's meaningful and it's helpful, and just as, hear them in the background going, hey, Tom, thanks for joining us today, and to get that education, because I can only speak to families, and, it's parents struggling and having a hard time with it, and then there's kiddos that you look at that are just along for the ride with what's going on with their life, and to see them settle in and structure and try to help so that they're not the next generation in this world that we live in is humbling. So I just wanted to add that little story.
Any other success stories you want to share?
Can I just say how cool it is that we have the people that we do here today, and that bringing people together and creating new and innovative things. Like, who would have thought 3 years ago that we would have a social worker in a library and an EDI coordinator and a new social service coordinator, in the police department, all sitting together trying to tackle this issue. So congratulations to the community for trying to bring people together to try to help make this solutions happen. But now it's your guys' turn. We're here, and you're here listening to us to kind of take the lead and say, okay, we understand this is a big issue and we need to work together. So I think that's the part that's missing here, is we need to work together. And we're all here and we could talk all night about how this is a big issue, but in the end we need to really work together, and that's what works, is when we work together.
Okay. One of the questions is, can businesses assist in the process of assisting the individuals that are ready to move into employment? What can they do to help with that?
So part of what I do in economic development, and I did this for 7 years sitting on the Workforce Resources Board in Kansas, is the WIOA program. It's a stem, or it's an offshoot from what was the Workforce Investment Act that came out in '08 as part of the recovery of that recession. That program was extended through the WIOA program, and there are training dollars that follow anybody that meets a certain demographic. It's unemployed, underemployed, dislocated workers, folks with disabilities, unhoused, a slew of qualifying factors that make folks eligible for the WIOA training assistance. Oftentimes you see it used for them to get vocational training or something through the CBTC, but what employers don't realize is there's some significant dollars that follow these employees to the workforce. They can pay for this employee who maybe has zero experience in your industry, but is willing to learn. There are dollars that follow them that will pay for their salary, will pay for their training period. It used to be up to $3,000 per hiree. So it's a significant assistance to encourage an employer to take a chance on an employee that might not have been otherwise an ideal fit, but has potential to adopt in there. The big key is that employers have to register with, in this case, it's the Workforce Resources organization here in the community. They can only direct WIA dollars to jobs that are registered through WIOA or through Workforce Resources. So I would encourage any employer who has positions open to reach out to Workforce Resources, get their positions registered and advertise for there, and then as positions come up, because I heard at least one of the partners up there talk about working with Workforce Resources to help their clients look for positions, these dollars can potentially follow them and help cover your cost to train somebody who maybe didn't have the background you needed, but could be a potential fit for your organization. It's highly underutilized by employers, and I've seen that in every district I've ever worked at within economic development. It's a small percentage of business that take advantage of it, and it's a program that's there.
Okay, so you've listened to us for an hour, so it's now your turn. If you have questions or comments, I'll walk around with the microphone. Why are you flagging me down?
I just wanted to point out that, as you know, these are opportunities for businesses, but also you have to look at your internal hiring policies and procedures, making sure that even the job description, the language, it's from an equity lens, so that no one group are probably excluded from it, the way the job description is posted. So the job description can be out there, but if you're not looking at it and really peeling back the layers of the onion to make sure that you're reaching a broad pool of applicants. So I just wanted to add that piece too.
Okay. Thank you.
Because you came from a different community, Dr. Janice Briggs, can you talk about, did you have this discussion at your past communities at all? No? Okay.
Different issues.
So Sarah was asking if Dr. Briggs had this conversation in other communities prior to coming here.
And what was her answer?
Her answer was no.
Sorry, I couldn't see.
Just me. Any questions or comments that anyone has? Well, it's not for us. It's for the people that are behind you on the camera.
Okay, hi. I have a lot of questions, but I think I'm going to start with my first one. My name is Erin Klaus. I own a business downtown, tangled up in Hugh, and I sit on the South Barstow Business Improvement District. And so we, as a board, have been fielding a lot of questions from business owners on how to deal with multitude of issues that we talked about tonight. Everyone's facing this issue in a different way. And I just want to assure you that there are people in the business community that are really looking at this in a way that we want to work with the community, and not just that this is a problem that we want to get out of here. I think one of the biggest struggles for business owners is that we obviously all have different needs and priorities, but we feel that we don't always get the communication we need on how to proceed. So honestly, I always thought calling the emergency or non-emergency number was exactly the appropriate thing to do. I mean, I've been told this probably multiple times in the 12 years I've been town, like, just call the non-emergency line. So I thought I was doing, my share to get information out there. So hearing that tonight was like striking, that I've been doing the wrong thing, as well as like sharing that information with people. So there's a disconnect going on between the powers that be and then the business community, and not understanding that. So that's huge. We recently formed an outreach committee on South Barstow Business Improvement District, covering a lot of different things, but really like getting this important information to the businesses so that we're all working together towards the same goal and not left on our own little island trying to figure out how to navigate this. And so homelessness, or the unhoused, came up a lot, but recently as, something we needed to discuss. So now I'm wondering, things that come to my head is, what should be our first contact then? So then we can take this information from tonight and get it into the hands of the business owners that are struggling with these issues we talked about. So am I calling Western Dairyland? Because it sounds like I really want to call you first. But I don't know. I mean, or is Sojourner the way to go? Because most of these people already, and then we can find what path they're already on. So I guess that first question, what is our first contact? With whom, and can I get that phone number and distribute it out tomorrow?
I think that they could call either agency. We're no wrong door agencies, so they could come to either agency or Family Promise or LSS. We're all no wrong door agencies, and when we get people on the coordinated entry list, we just all work together and place them in. Yeah, it's all on the same list, and we do case conferencing together. We do, we just do a lot of things together. We do way too much together. So you could really send them to any of our agencies.
What Jeannie said, but also the first step is the person in front of you. Yeah. It's that person right in front of you that you're wanting to try to help. Ask them, what do you need?
And so I think many of us have done that. I think this is where that concern is coming from. The questions we're getting from businesses are, what is too far? How far is too far? I'm wondering if this person's being trafficked. I don't know. I don't know the appropriate way. So this, creating this event came out of this discussion of, we want to be that. We can't obviously invest as much time or energy as maybe you folks can, but of course we want to be there first and do that. But then it's like, we can try however many times, and some people will feel not comfortable being able to approach someone. So, how do we get someone who we know can get them to the resources they need down there to help us with that process?
And I'd like to address, if you ever suspect that somebody's potentially being sex trafficked, you can call Bolton 24 hours a day. We have full-time sexual assault advocates. We have a mobile advocate, and she's out and about in the community. She can come talk with you at the business, probably talk to you about things to look for, so don't ever hesitate to call.
Okay, and so what I'd like to do, using what you had and some of the resources, just getting it into probably the hands of Decky then to help us distribute this, because I think that's, again, the first question. I know I'm talking a long time, so I know other people want to ask questions, but I do have one more
Can I just
question.
Say one more thing about that? So we also have staff that will come to you. So I think both Gaining Ground and, all of us do. So we're more than happy to send them your way if necessary.
Yeah, I think I'm thinking of specific circumstances already that probably would have been really helpful to have that information on the ready to be able to do that. So I really appreciate that answer. I guess my other question, I don't know if maybe Andrew or someone has more information about this, but we talked about the housing first and being so crucial to enable, positive moves forward. How do we help that? Where does the money come from? Where is the city sitting on this issue of creating affordable housing? it feels kind of like just a continued cycle of there'll never be enough. You know, when you mentioned 25 for the top priority people, I'm just thinking, my goodness, like that's not even a drop in the bucket for what our needs are. So where does that process start? And then how, I mean, I don't know, but how could the downtown community and business community be part of that solution?
Sure. So for our Housing First or Permanent Supportive Housing Program, we're mainly funded by the Division of Housing and Urban Development, so HUD. We also get some money from United Way, and that pays for leasing, in-depth case management, operations, you know, those kinds of things. We are always looking to add more units, add more individuals, because right now there are plenty on the list that need to be housed, and we just don't have the financial resources to expand. HUD funding comes about every once in a while. I mean, we can't always apply for it. But when we do, I mean, we try to expand the program. So if you know of any other resources out there, let us know. We apply for grants all the time. So yeah, it's a great program. It's been serving us well and the community.
Any other questions or comments? I'm going to let you wait.
Hi, TJ.
Hey, Jack.
Thanks, TJ. I'm Jack Kaiser with Saigon Properties in Banbury Place. Obviously, I think most people are familiar with Banbury Place, but we also have 7 commercial properties downtown. And I value what you're saying about the type of the homeless person that's out there, and I really feel for the families that are on bad luck, the people that have a bad luck and that type of thing. But there's another individual out there that I think you won't even serve. It's the homeless person that has mental health issues, drug and alcohol issues that are wandering our streets and cause a lot of problems. We have a tremendous problem with these type of people. They camp out at Banbury. They do damage at Banbury. They leave drug paraphernalia at our properties. And this is we got to do something about. And I don't think you guys can even do anything about, because they're in a different class. And these are the people we see walking around downtown. If we want a good downtown, we want a quality of life downtown, we got to do something about this. And we call the police on a pretty regular basis at Banbury because we find somebody laying in a corner, passed out. They're intimidating. They scare our tenants. They scare the customers of our tenants.
Those are exactly the kind of people we have housed in our permanent supportive housing program. So I just wanted to point out that's 25 less people on the streets now because they're in housing.
Yeah, well, that's
so
good.
If we had more
there's
units,
25 more out there that are causing.
Oh, there's way more than
issues,
20.
You know,
Yep.
I'm not saying you're not trying to do something, but it you know, this winter, this March, we had a homeless individual with obvious mental health issues start his coat on fire in a hallway in one of our buildings at 3:00 in the afternoon.
Every person sitting on this board tonight works with those people every day.
I'm sure you do, and I commend you for doing that. But it's a really very big frustration being a business owner, property owner. You know, one of the first questions I get out of a tenant that wants to come downtown is, it safe? Well, I tell you what, we spent thousands of dollars installing security cameras at Banbury, at 3 of our properties downtown, just to monitor activity of these people. And you know, the police, I respect them. They can only do so much. And as the officer said, I mean, they know them by name. I mean, you know them. They know who they are. Well, it's more of a comment.
Got short legs.
Oh, good. I'm with you. So there's also another level to that, right? The mental health, the alcohol, the drugs. The individuals that we're serving every day, we are trying to get them into programs, and the waiting list is months, if not weeks. So we may get them into a hotel for 3 weeks, 2 weeks, maybe even a week if we're lucky, or a midway crisis for a couple of days. They get out, they're feeling down on their luck because their self-worth is about nothing. And then we relapse, we recycle. It's a continuation every day, over and over. I have a gentleman waiting to get into Harmon. He's been waiting months. Can't get him in. Working with parole officer, working with the community. We continue to relapse. It's something that it's bigger than, it's another gap in services, but it's bigger than just wanting to go out and destroy property. I asked actually one of our homeless individuals who was homeless, then became our intern. When we ask people to come to meetings or to sign up for appointments or to accept our services and there are no-shows, or they decide, you know what, no, I don't want anything today. Example, like Marilyn, working with her, trying to work with her for 8 months in the hockey arena. And she didn't want the help. And that's okay. The individual shared with me that it's because just to wake up in the morning is sometimes all you can do. Sometimes just getting up to, open the shade or get out of bed, that's as much energy as they have. And then the mental health starts to kick in, and then maybe some addiction pieces. So there's a self-worth of these individuals when they're going through this, and also just feeling like, that's something as our program that we look at is when we say we're going to do something, we follow through. Because we hear over and over and over again. It took a lot of courage for me to come here today and ask for help, but I'm going to be completely honest with you, Angie. I don't think you're going to do it. You're not going to follow through. While we may try, sometimes we wait and wait and wait for something to fall into place for them, and we're relapsing again or going into the cycle of destruction for personal self, or going to an apartment building or whatever the case may be. So I just think there's, again, like peeling the onion, there's so many different layers to this outside of just mental health. It is the self-worth piece too.
And to tag on to what Angie's talking about, people don't wake up in the morning, choose to be drug addicts or alcoholics. If you were to look at the homeless population, I haven't done it for a couple of years, but when I sat on a committee where I was doing demographics for a point in time, it's in the 50-some% range of homeless people who have a significant childhood background trauma. Eau Claire's very fortunate to have treatment courts in the community. Many other in the state don't have it. One of the programs is called AIM Court. It's Alternative Incarceration for Mothers. They do a test on everyone who applies. They're already in the jail system. They do a test to see where they're going to score. If I might be off a little bit, but I think the highest you can score on it is like an 82. The women who are applying to get into that are routinely scoring about a 78. That is how significant their childhood trauma is. Many people use drugs and alcohol as a coping mechanism. If you were to look right now, heroin is at the value of about 25 cents on the dollar to getting a prescription opioid. These people have no money. Where do you think they're going to get? They're not going out and getting medicated. They're getting something off the street. And that then becomes addictive behavior. It's how they've coped for years. I don't believe there's any homeless people on the street who choose to be a drug addict or an alcoholic because they wake up, like Angie said, every morning feeling pretty awful about who they are. I asked someone one day, I was working with her, and she was so remorseful over what she did. She lost her children over what she did. Why are you doing it? And she said, I just don't know. I feel so bad, not another day seems any better. So what do you do with your day that's not going to get any better? You kind of wipe out the day. You get high. And now you're not even thinking about your day. Your day is just nothing. And that's how many of these people are coping.
Can I just say something real quick? I think it's unfair to also not acknowledge that that is a real problem, and from his perspective that, you know, this is an issue, and I think it's fair for, I mean, we rented from him. He was a very good landlord. He treated people with respect. So I think we're seeing the issue from all of our different angles, and I think, you know, we need to all work together to, you know, he's running a business. He has to do certain things. He wants people to feel safe. So I think if we all work together on this, I wish I had a better solution, but I feel like we need to acknowledge that people in the community are feeling that way, and they're business owners.
Yeah, that's what I was going to say is there's got to be, I mean, we can talk about something at the end that's been proposed, but there's funding tied to all of you. I think that's something to remind people. It's not just given. You guys are fundraising a lot of times, applying for grants federally. I guess my question just we have about 10 minutes left, and I'm a timekeeper for people who know me in the room. But I guess when you guys talk about that coordinated list, I just want to understand better how many are on that list. You said like you're waiting. Yeah, okay. And then the other part was just how often do you meet? Like, is it if somebody, a business owner, points them in your direction, is it just a digital quick meeting once a day, once a week, once a month? I guess I just want to understand that part. And then I think if we can go to that last part, that'd be great.
So the coordinated entry list varies. We're switching computer systems right now, so it has been, it's just been a little tricky. But I think the last time I checked, there were around 100 singles on that list, and I think there were like 10 families, 5 to 10 families. So singles are the biggest population, obviously. And then your second question.
Do your coordinated meetings?
So it depends. So like service providers or when we meet with the homeless?
Well, more like if a business owner were to call you and say, somebody needs help, and you guys were to
Sure. It really depends on what they need. So like we've been giving out phones and phone cards right now so that we can actually reach these people and stay in contact with them. It varies though. They can come to our office. They have access to, we have a food pantry in our office. We're always giving out food, we're giving out clothing, we're giving lots of things, and we're like case managing kind of at the same time. So we're helping them with these housing applications if they want help. So it's very client-centered, very individualized, because some people really only want a little bit of help and some people need a lot of help.
Yeah, we have the last 5 minutes and just wanted to have Judy talk about a proposal that's come up.
So I'm Judy Mosley, and during the day I'm a mild-mannered real estate agent, but at night I turn into the co-chair of the Jonah Affordable Housing Task Force. And our role in this new proposal has simply been to bring people to the table. So most of the people who are up on the panel and quite a few of the attendees tonight attended a meeting at our offices last Thursday to talk to a developer who has said, you know, I have a piece of land that might be in a good location for a 24-hour shelter, and I have the ability to build the building, but I need all of the community to decide if this is what they want, what services they want, what it would look like. Can we afford it? we have to answer all of those questions. So last Thursday, a group of us convened to just start figuring out what are the questions we need to answer. And what are our next steps from here. And so right now what we're doing is just trying to get interested people to the table, people who need to be there, who have things to add, who want to be part of the process, and who have a vision for the future for how our community can best serve houseless individuals. So that's where we're at right now, and we will just keep taking it step by step until we have a clear understanding of what the community wants and how we can best respond to this issue.
Is it an option for that not to be a 24-hour shelter, but instead maybe affordable housing, affordable apartments, supportive apartments?
Yes. Yes, it is. I could do it, Judy. It's in its infancy, and so there's nothing locked in stone as to what it is. But the developer needs community input from providers, from business, what needs to go in there to fill the gaps that we have in Eau Claire. Judy, did you want to?
Well, right now we had our initial meeting of service providers, and then next we're meeting individually with different service providers so that they can flesh out a little more of if this was going to work for us, this is what we would need. And if we were able to participate in the funding for this, this is what we could contribute. So those kind of questions. But then we're going to need to be having public discussions next. More discussions like this. More discussions where members of the public can give input, who can give very good ideas, because boy, do we ever have a group of caring community members who have really good skills and really good ideas. And so, you know, over the coming weeks and months, we'll be having a lot more public discussions. And I'd really like to hear as many of you as possible participate in that. You can contact me. The Jonah, if you look up the Facebook page for the Jonah Affordable Housing Task Force, you can contact either me or my co-chair, Susan Wolfgram, and we will get you connected with those discussions.
Hi, my name is Steve Harmon. I own a property at 705 South Barstow for 30 years. So I'm kind of one of the senior owners of properties, I think, in the downtown area here. Obviously, we thank all the people here for what you do with the homeless people and helping them, whether they're mentally challenged or physically challenged or whatever it is. But and there's great plans for the community to help. I think there's $33 million we're looking at between the city and the county. That's going to be available for things. Sojourn House is looking at an expansion. And we look at months and years down the line, but what we need is something tomorrow. Can somebody get some porta potties, please? You know, so we don't have to see people dropping their pants in the park and going to the bathroom. It needs to be done now, tomorrow. If these people are costing us $35,000, according to a report from the Catholic Charities in 2019, that the average chronic homeless person costs the taxpayer $35,000, you know, we need to address those issues on a longer term, but on a short-term basis, we got to do something. It makes no sense that the Sojourn House closes their bathrooms during the day. If you went to a dog shelter to adopt a dog, they wouldn't let you adopt that dog on the standards that they're putting people through. It needs to be addressed now.
Can I address us putting up porta potties around town? If porta potties, and I realize they do need to be there somewhere, they really need to be cameraed. I can't tell you, we've already had a baby born in the shelter due to a porta potty. The rate of sexual assault and drug activity that could occur in a porta potty just placed in the park could end up being horrendous. So if we're going to have porta potties, we have to think.
Not in the past. We were a night-by-night shelter, so we would open our doors at 7 at night and then staff it until 8 in the morning. It isn't until recently that we have moved down there with our St. Lawrence Community Services. LSS is in that building as well. So yes, people are utilizing the restrooms, showers and laundry on Mondays and Wednesdays from 8 to noon. So we are a resource that they can utilize if they do need to use the restroom.
No one is disagreeing that it's an issue, yeah.
Yeah, so I acknowledge that the bathroom is an issue, but our staff, the reason that we're down there, and I can't speak because we just rent space at LSS, just rent space, but answering that door and letting people use the bathroom is a full-time job. People, and I know that it's a need. I wish there would be bathrooms in, is it Owen? Not Owen Park.
Wilson.
Wilson, thank you. But it's a full-time job answering that doorbell, then watching people in the bathroom. So I hate to keep saying that, but just having bathrooms is more complex than just having bathrooms. And I really think that there needs to be a solution to that, and that is something that we've all talked about, that there isn't enough bathroom access. So I think we need to work together on finding that solution with maybe the city or anyone that has a solution to that.
I want you to know, too, that individuals experiencing homelessness want to use a bathroom. They do. I promise you they do. We recently surveyed individuals experiencing homelessness because their voice is the one that's missing at the table. And by and large, they said, we need bathrooms and we need them downtown, but we need safe bathrooms too downtown. So again, yes, that is something that I think we can all agree on is something that we can maybe work together and use our voice to make happen.
Yep, and then we'll need to wrap it up because we don't want to keep you here all night.
So as a business owner, I've had multiple different locations on Barstow Street, and for 12 years have constantly had a stream of people coming in to use the bathroom. Our business mission was to never turn anyone away for that need, but there's still a real risk involved there too, because we've experienced the full gamut of drug use happening in there, where we had to get in there to help the person because they're not able to leave themselves, or people showering, bathing within our sink in that capacity, and getting that awkward moment of trying to ask someone if they're okay and can leave. But we also employ teenagers that work there in the evening and don't feel safe at certain times of the night, especially when Sojourner was only open at 7 p.m. and it was kind of, we were still open. We were one of the few businesses open. And so we had a lot of people coming in to just have something to do, get out of the heat, get out of the cold, use the bathroom. And so it's really hard, I think, for a lot of business owners, and a lot of business owners don't allow it. They're just absolutely against if you're not a patron, you can't use the bathroom, and there's good reason for it. And so there is a need for it. And I recognize, what you're saying, and we can't just throw up porta potties, but I think it's a very serious issue. And it is keeping business owners from engaging with this population in the way that could be effective and meaningful. So I agree that something has to happen. We can't expect all of the business owners to be able to allow the use of their space for that reason, especially because, again, it's just, it becomes a really uncomfortable cycle of how to get past when there is a problem, and it happens more often than not. And so I do think it's a focus that we absolutely need to address, finding safe spaces that are available, and then letting that population know where those places are. So that's just comment. Thanks.
Anything else? Well, I just wanted to take the time to thank everyone for coming. We're not going to solve the problem tonight. As we all know, it's very complex, as we've already heard. But the conversation needs to continue. So reaching out to any of us, reaching out to Decky, the conversation will continue, and we need to figure out this together. So I've been in this community 20 plus years. I'm very sure that we can do it. I've seen you do some amazing things, and I know it's just time. It'll take time for those discussions to roll out, and where to find the money, and how to make sure that we're keeping everyone in the community safe. So again, thank you for coming. Thank you for the panelists for taking time tonight.
One more thing, if anyone wants a Gaining Ground flyer, I'm just going to leave them here, and please feel free to take them. It has our phone number, and leave a message if nobody.
Yep, and I think Sarah has some other resources as well for
I can
the
put them
No Wrong Door. Yeah.
Can I just reiterate, our Dairyland Housing Coalition meetings are held every month. Anybody is welcome to attend. We actually would love to have some business owners on the coalition.
Definitely.
We meet Wednesdays from 1:30 to 3, the third Wednesday of the month via Zoom. So let us know if you're interested.
Yeah, if you're wondering, Jeannie's a chair of that, and I'm co-chair of that. So if you want to get your contact information to us to be on that, we can get you some information about that particular coalition as well too. But round of applause for our panelists. Thank you for Decky for hosting this. Everybody have a great and safe evening. Thank you.